surgical wait times of some people looking to pay out of pocket for private options. Everything Financial's Peter Sashecki joins us now with some things to consider if you're planning to pay private clinics to beat pandemic delays. Good morning, Peter. Good to see you.
Nice to see you, Carrie. Good morning.
So when it comes to paying out of pocket for surgeries, who can benefit from that?
Well, most people can, but especially the really business owners. If you own a business, it's a way of getting money into your pocket to pay for the surgery without having to pay like taxes and EI and CPP and all those extra premiums you pay when you take salary in your pocket. And you can even do this for key employees of your company as well. And it's all done through a health and welfare trust, which we'll do in another segment in more detail. But it can really help. And if you need that, that knee surgery or that shoulder surgery or something that unfortunately the lineups, even before the pandemic, were ridiculously long, you can get your surgery done and you can get the money in your pocket with barely any taxes, really about a 10% fee instead of all the taxes.
Yeah, I guess it works, for people who can afford to pay and not necessarily those who have to wait in the system and wait for their surgery. But there are tax advantages if you are able to do that. Tell us about it.
Yeah, so if you say a surgery is $10,000, just, I don't know, a nice even number. Well, if you had to pay for that out of pocket, out of your income, that could really mean you have to take about $17,000 or $18,000 of income to pay for it. But if you are so lucky that you can do this through a company and doing this thing with the health and welfare trust, that $10,000 might cost you about $11,000. So that's a huge benefit to be able to get the money in your pocket with so little fees and really no taxes on that money. And that actually doesn't just help the people getting the surgery, that actually helps everybody, even those who can't afford it.
Because it, in theory, would lessen people waiting in the system for that same surgery.
Well, it actually does. If you look at the numbers pre-pandemic, which is really what we have to go by, is doctors still have to do a certain amount of surgeries. They have to be in the hospital available to the healthcare system, which is great, and help people who need those surgeries and whatnot. But when you're getting these private surgeries done, you're not taking a spot. You're actually freeing up a spot, because I can tell you, Carrie, from knowing some people who've had this done, you're not getting the surgery done at 2 p.m. Let's just put it that way. Sometimes it's 5 a.m. And these at certain surgical clinics, or 11 o'clock at night. So the regular, if you will, surgical hours in the hospital are freed up for people who unfortunately are on the waiting list.
Yeah, how else did it help the public healthcare system when it was allowed?
Well, when it was allowed, that was really it. You saw the numbers way back, and we were looking at the numbers the other day when this came out, that there's now a freeze on this again, and there's a fight between a local surgical clinic and the government again to get this done. The numbers of people waiting for these elective surgeries, and we're really referring to a lot of knee and shoulder and hip type things, the numbers of people waiting continually went down as these surgical clinics were able to do these surgeries. And then everybody benefits. So the person who really can't afford anything, but blew out his ACL doing whatever, and now he can't work and he's on disability, well, he or she will get their surgery quicker, but they also help the system because they're not on disability, or maybe they did it at work and now they're no longer on workers' compensation, or at least their time on disability or workers' compensation is definitely shortened. And that's good for everybody, because then those people are back to work quicker.
Yeah, well, whether it's through the private system or in the public system, the sooner you can get fixed or whatever ails you and get back to work or get back to being productive, that's the most important thing, Peter.
Exactly. You said the key word there too, Carrie, productive. And the quicker you're productive, the better it is, as we've realized in this last 22 months, for your mental health as well.
Yeah, indeed. Peter Sashecki, Everything Financial. Thanks for joining us, Peter. Have a great Wednesday.
Thanks, Carrie. Have a great day.
You too.